A new virus has cropped up, as you all know, in China, a new coronavirus, which is related to the standard virus for influenza, but it has not been seen before. It's a novel virus, so that the likes of this virus has not been seen before. So as a result, a race is on right now to get a treatment, some kind of vaccine for the virus, which is something that cannot be done overnight. So they're talking about having the new treatment in by the end of a couple of months at the very least, maybe 16 weeks. So right now the problem is, how do we treat the patients that are coming up? And as of today, the number of uh, known uh, sufferers from, or known cases for this virus has exceeded 2,000, which we know is a very big underestimate. So we can multiply that by a factor of at least 20. And so we are looking at the number of cases in the neighborhood of 40,000, maybe 60,000, maybe 30,000, in that neighborhood. So the question is, how do we treat the sufferers today? And that has been a problem. Now, what has happened is that uh, there have been other kinds of treatments applied to retroviruses, such as that of HIV. Those are combination drugs of usually a double cocktail or triple cocktail that have been used for HIV/AIDS for several decades now. However, a news has appeared today that um, the Chinese Academy of Sciences, Academy of Medicine, has actually started a trial of applying some of those combination drugs, and specifically lopanavir, for specifically treating people with the coronavirus. This is completely new and completely unheard of. Some years ago, with a colleague of mine, Bradley Condon, we wrote a book on HIV/AIDS. At that time, the idea of applying these kinds of combination drugs for something other than HIV/AIDS was not at all seen. And if that becomes the norm, then a lot of things about what should be applied for emergency purposes for these kinds of diseases, and should the companies be allowed to uh, recreate the drugs, especially in developing countries, to treat these kinds of things, becomes very relevant one more time, as we saw it happened in the case of HIV/AIDS.